We all love a legendary comeback, and Degree Original Cool Rush is back and better than ever. Cool Rush isn't just a scent, it's a movement, a fan favorite that delivers bold, fresh vibes and all-day sweat protection. Whether you have a man that spends hours in the gym, heads into the office early, or is just trying to stay fresh on a long day, Cool Rush has their back. Head to your local Walmart or Target and grab Degree Cool Rush, the fan favorite scent from the world's #1 antiperspirant brand.
I turned off news altogether.
I hate to say it, but I don't trust much of anything.
It's the rage bait.
It feels like it's trying to divide people.
If we got clear facts, maybe we can calm down a little.
NBC News brings you clear reporting. Let's meet at the facts. Let's move forward from there. NBC News, reporting for America.
Hello, my name is Damon Friedman, co-founder and president of SOF Missions. As a 20-year veteran within Special Operations, I've gone through many challenges due to my military service and time in combat. We felt called to start SOF Missions to serve our fellow brothers and sisters in arms, focusing on suicide prevention and resiliency. Our mission at SOF Missions is to empower warriors to find purpose and be resilient. Since 2011, when we started the organization, almost 3 million men and women have deployed to Iraq and Afghanistan. Unfortunately, the scars of war take a toll on their psychological, physical, social, and spiritual health. Many veterans feel a sense of hopelessness and a loss of purpose when they return to civilian life. They feel isolated and alone, unable to reconnect. And in the greatest of tragedies, over 20 veterans lose all hope and take their own lives. Our goal at SOF Missions is to provide veterans the tools and resources so that they don't become a statistic. We offer a unique approach to combating veteran suicide through a whole health, intradisciplinary model. The Be Resilient program is a 4-pillar methodology that addresses the areas of psychological, physical, social, and spiritual wellness. We provide care through 3 delivery methods: medical clinics, retreats, and educational training. Since we started back in 2011, we have been able to reach veterans in all 50 states and have served over 3,000 veterans through the Be Resilient program. Being resilient is a multifaceted and complex issue. We know that to find a lasting solution, we have to address the whole warrior. Many challenges cannot be solved by providing the treatments and modalities of just one component, but by tackling them all. Now, we've expanded our services to include law enforcement and first responders. Together, we can make a lasting impact in the lives of warriors across the nation. To learn more, visit our website at sofmissions.org.
All right. Welcome back.
Misfit Nation. The Misfit Nation Show.
We are a show founded by a veteran and hosted by 2 veterans and a military spouse. Our mission is to get people to tell their stories to the world. If you're an author, share your tips with the Misfit Nation. If you're a musician or an actor, our audience needs to know how they too can get into the business. Coaches, we love our coaches. Come on and share your tips with the Misfit Nation to help them become better versions of themselves. If you are a corporate leader or an entrepreneur, come on and show how you did it and how hard you have fought for success. If you are a veteran, first responder, or Gold Star family, we would love to have you come on and share your story with the Misfit Nation. We always have time for you. If you're feeling down, alone, or starting to see the darkness, stop. Think about those who are around you. You are not alone. You will be missed. If you feel like your problems will be a burden to those in your inner circle or feel embarrassed, dial 988. If you are a veteran, take option 1. We need you to keep pushing forward. Don't make a permanent solution to a temporary problem. If you are a new listener, welcome to the Misfit Nation Show. Be sure to subscribe to our show on your favorite podcast app. Also on our YouTube channel at @the_Misfit Nation. subscribe and click the bell to keep you up to date on our latest episodes and all of our news. You can also find us on Heroes Media Group and About Face Radio. Now, let's get to the show!
Woo! All right. It's that time again. The time you've been waiting for all week. The boys have been playing around. They know the day comes. It's Tuesday night, and we are live. The week may have tried to slow you down, but guess what? We're here. We're loud, and we're cranking it all the way up. You came for the energy. You came for the truth. You came for the Crüe. And tonight, we've got stories, the laughs, the fire, and full throttle madness that keeps Tuesday standing above every other night of the week. So, misfits, stand up, get loud, and show them how we do this. Make some noise for the unstoppable, the undeniable, the duo that bring the heat every week, or solo tonight. Steven, representing the ToosDay Crüe.
Sweet Caroline. Good evening, everybody. Did you go out and vote today? I did. I would have had my little sticker, but I gave it to my daughter because they ran out when she won. So you can't see that I voted. They voted this. I voted today. Anyway, it's a beautiful Tuesday. Life is good. We did our normal running around doing errands and stuff today. Tonight I have with me Dr. Derveer, Will. He's co-founder of Integrative Psychiatry Institute, offering comprehensive training for mental health professionals and psychedelic-assisted psychotherapy and other continuing education programs. I'm going to bring him out right now and have him talk to you about it. Good evening, Doctor. How are you?
Hi, Stephen. Thanks for having me.
It's a pleasure having you. I just gave a little 2-second blurb. I want you to come on and tell everybody all about yourself and what you do and how you do it.
Thanks. I appreciate the opportunity. I really enjoy the intro to the show, too. It really aligns with what we're trying to do in our institute.
Good.
So
we push it all the time. We're out there to help.
Yeah, it's so important. It seems like every year it gets a little harder. It gets a little darker, at least in recent months and years since the pandemic. Mental health, even more of a problem than it's ever been. And not just with veterans, but for civilians, non-veterans. Should I just tell a little bit about how I got to where I am and what I'm up to?
Yeah, I would love that.
Great. So I'm a psychiatrist by training. I started my journey in the conventional medical world of learning how to prescribe medication and do talk therapy with people. In my training, I worked at the VA in Denver. I worked at the General Hospital in Denver and the University Hospital. Saw a lot of different kinds of problems, different kinds of things. Certainly plenty of folks on the edge, in the depths, in the darkest places. And in my training, I was taught that medications and therapy were the way to solve those problems for people. And I saw a lot of people get benefits from that. But I also saw drawbacks, side effects, expenses to therapy, medications not being effective, and so forth. And in particular, this concept of the combat cocktail, guys coming back, women coming back from the Middle East and getting put on antipsychotics, mood stabilizers, benzodiazepines, antidepressants, anticonvulsants, anti-what have you, and even opiates, and just going deeper and deeper and deeper down a hole with not much to show for it in terms of benefits, which is incredibly disheartening and alarming. And in my own practice as a young psychiatrist, I saw the limitations as well. You know, I started to practice, I was doing talk therapy, I was prescribing medication, and it did help some people, but there were too many people, and I would say the majority of people either didn't get any benefit or got inadequate benefits from what I was able to provide them. And I got very discouraged, and I ended up quitting psychiatry for a period of time in my 30s. Now I'm in my mid 50s. And then I had a patient who had struggled under my care for a long time. He had terrible panic attacks. He couldn't go outside. He couldn't date. He could barely work. A beautiful young man. And he had, there was a woman that he wanted to date. He couldn't ask her out. He was too scared. And he also had terrible stomach aches. And I thought, well, it's probably anxiety. So when I quit psychiatry and left town, he went and saw another doctor, a naturopathic doctor, who tested him for celiac disease, which is a severe wheat allergy that affects your digestion. And he came back positive and stopped eating wheat. And within a period of weeks, this incredibly severe anxiety that he had was gone. It melted away. And then he tapered off his medications and he still had no anxiety. And to this day, we keep in touch. He's still anxiety-free, has been for decades now. And it woke me up. It woke me up to, that 1 hour of nutrition that I got in med school, maybe that wasn't enough. Maybe I need to learn. Maybe I need to learn the gut-brain connection. Maybe this thing that we say to patients called treatment resistance, maybe the better word for that is doctor ignorance, because that's who I was. I was an ignorant doctor. I didn't know anything about that.
Well, you were going with what you knew and what you did, and a lot of the times it worked, so you kept doing it.
That's right. That's right. So that kind of was a springboard for me to go into re-educating myself and learning about a lot of different things that I wasn't taught in med school. And of course, the field evolves, and it evolves slowly, but there were things that didn't exist when I was in med school. So in fairness, I got a good education. I went to a good school, but it just didn't have all the things in it that we know today. And there's still a lot we don't know, but we know a lot more. And so I started working with people on their gut health. I started working more with nutrition and exercise and sleep and chronic stress conditions, adrenal stress, looking for parasites and imbalances in gut bacteria. And I just went down the rabbit hole. And that helped a lot more people than I was able to help before. But there were still people with terrible, severe trauma who weren't getting better from all these new tools. And so around that time, I got invited to participate in a clinical trial looking at a new treatment that I was very skeptical about at the time, but it was called MDMA-assisted therapy for PTSD. MDMA is a drug that on the street is called ecstasy or Molly. So it is a drug that people use to party, to get high. Right. But when you use it in a controlled setting and you have therapists working with you, it's a completely different animal. So in the study I did with my colleagues, we had a group of people who'd been suffering from PTSD for more than 29 years on average. So this was long-term PTSD and pretty severe. And by the end of the study, 2/3 of the people no longer had PTSD. So at the 1-year follow-up, even more than 2/3 remained free of PTSD. So that went into a phase 3 study. The FDA reviewed that last summer. They said they want a little bit more data before they're willing to approve it.
Right.
But between MDMA-assisted therapy and 2 other drugs that we use for deep, dark, severe trauma, those being ketamine, which we could talk about, it's currently available, fully legal, and the other one being psilocybin, which in my state, Colorado, approved, and the state of Oregon approved. We have now what I would call the future of mental health care. We have new tools that are going to help people who've been waiting, if they haven't already killed themselves, for decades to get help.
Yeah, we have interviewed and I've heard stories over and over how they go to the VA and they have these problems and the VA gives them a bag of pills and says, here, take this, go away, and that's it. They don't even, try to help or try to do anything. They just want to drug them up and move them along.
That's right. That's
there
right.
Has to be, and you're actually finding the other steps to helping and fixing that. So that's a great thing.
Yeah, unfortunately, there are VAs, for example, the Bronx VA in New York and VA in Portland, Oregon, who have been a part of these new studies. So, change at the VA is pretty slow. It's slower than it is maybe anywhere else in healthcare. But they are participating, and that's pretty encouraging. So, so my message is a message of hope that help is on the way. It always takes longer than we want it to. But I'm happy to talk about any questions people have about how does it all work. I recently wrote a book with my co-founder of our institute, Keith Kurlander. We wrote a book called Psychedelic Therapy. It's coming out in March, and it's a step-by-step guide for people who want to get information and make a decision about whether that's the right fit for them.
That's fantastic. And you said it's coming out in March. Is it going to be available online? Is it going to be Amazon or something? How are we going to be able to find that book?
Yeah, it's already up on Amazon right now. You can look for it under my name and the title. It won't get shipped to you until March, but you can reserve a copy. I'm right now this week in the process of recording the audio book version, so you can also listen to it if you'd rather do that.
You're recording it? So
yeah.
It's going to be nice and relaxed because you seem very laid back and calm, so it'll be nice to listen to.
Thanks, Stephen. Sometimes my voice puts people to sleep, so I appreciate the feedback.
And I'm used to speaking to all different people within the last year on this show, and this is like very relaxing conversation we're having. This is amazing. All right, we have a question coming from the viewers already.
Great.
Top of that. At Make Me Speak, we are in a community of vets. We in the community of vets see the push for these practices using K and MDMA or even cannabis. Are these truly good things or something the patient will need to use forever?
That's such a great question. Such a great question. So at the risk of going along a little too long, and this is a little bit of a pet peeve of mine, that in psychiatry we have this view that the chemical, i.e. the medication, the pill, is the answer to your problems, right? And it's a misunderstanding. It misses, medication, whether it's ketamine or MDMA or cannabis or the other meds that you get at the VA, they may have a role to play, and that role could be really important. For example, ketamine has a very unique advantage that it can interrupt suicidal thinking very quickly. So it's a common phenomenon for very suicidal folks who start a ketamine treatment to have relief of suicidal thoughts within 24 hours, which is so helpful. Now, that also comes, in the case of ketamine, it comes with benefits that wear off pretty quickly. So that's a huge problem, right? Because if the whole point of this is to get people past the mental health care system and back on their feet and independent, the last thing you want to do, if you're me, is condemn someone to yet another round of long-term medication. So what I'm excited about with regard to MDMA and psilocybin is kind of related to what I shared before, is that in the study we were doing, treating people with severe PTSD with MDMA-assisted therapy, the protocol was only for 3 MDMA sessions. So the person only had to come in and get the drug 3 times. It lasts for a long time, so it's an all-day session. But those 3 sessions produced these long-term results. And in studies with psilocybin for depression, we see results after taking one psilocybin assisted therapy session, benefits lasting for 6 months or a year. So now the risk here is that people like me, doctors like me, if they're really stuck in the medication is the treatment model in their mindset, they're going to look at these new tools the same way. And so you have people opening ketamine clinics, getting people feeling better with ketamine, because ketamine makes 50% of the people you give it to better from depression within a couple weeks. But then they're like, oh, now this person's going to respond to ketamine. I'm just going to keep giving them ketamine and keep them on the ketamine long term. I think that's a huge mistake for a lot of reasons.
Well, don't you become immune to it after a while?
You can get involved.
I remember when I dislocated my knee back when I was 17, and they gave me Tylenol or codeine, and I was taking it like it was Tic Tacs, and after a while, it just wasn't doing anything. And
That's
to this day, when I have pain, I'll take the bottle of leaf, just pour a handful, and take them trying to get the pain down, because one or two doesn't help anymore. You're just so used to it, your body adjusts, and it's like, hey, what the hell are you doing? It's not working. You know?
Right. So the new paradigm is trying to get after what the root causes are of the depression or the PTSD.
Mm-hmm.
And not just focusing on getting the symptoms relieved. Getting symptoms relieved is great. There's nothing wrong with that. It's a good thing, but it's only part of the story. You got to get to the root cause. And the root cause could be from anywhere in your system. It could be from these problems that people often have when they get back from war with their gut. It can be a big issue. It could be a chemical exposure. It could be a chronic infection that you don't even know is in your body. It could be a brain injury. It could be a trauma that you went through. It could be your genetics don't process things very effectively. You get a buildup of things in your body. There's so many different things that need to be looked at to get after the root cause, so you can relate to these new tools as a catalyst to get you back on the road to recovery.
Yeah, that's the biggest thing I worry about. I feel sometimes, most of them don't want to sit down and talk, and when they get the help, they really don't want to open up. You got to get them to open up, and then you got to get them to relief for the mind and for the body. And that's the biggest problem, is to get them to open up and come to you for help.
I totally agree with you, Stephen. And one of the interesting things about MDMA for PTSD is that it comes with one of the chemical effects of MDMA is a substantial increase in the hormone called oxytocin, which has nothing to do with OxyContin. I have to say that right away, because sometimes people say, what? Oxytocin is a hormone that helps you relax and be less fearful and trust other people who are around you. Oxytocin is released when a mother is breastfeeding, in both the mother and the baby. So it's a bonding hormone. So what happens on the MDMA in the session is that people naturally are supported to open up more easily. And so what I saw with my participation in that work was exactly what you're talking about, Stephen, is that without MDMA, trying to get people into recovery with PTSD, just the part about them learning to trust you as a therapist could take months or years even. But with the support of the oxytocin from the MDMA, it happens a lot faster. So that's a way that I think MDMA can make the recovery journey a lot faster.
I have another question coming in. I think we've talked about this, but I'll just bring it up. At Hearn Weight, what inspired you to pursue psychedelic-assisted psychotherapy as a career focus?
Well, that's an interesting question. I'm happy to discuss that. When I was growing up, my father was a veteran, and my mother had a lot of mental health challenges. And he was an alcoholic, and he ended up in prison. And So I grew up in an environment, I thought that was normal growing up. I didn't know that that was weird until until I grew up and I started noticing that I had a lot of anxiety in relationships and a lot of fear of abandonment. And it took a lot of talk therapy and a lot of different kinds of therapy for me to start to understand that I had trauma in my system and that there were ways to heal that. So I did a lot of therapy. And then at a certain point in time, I had a friend who invited me to an ayahuasca ceremony. Ayahuasca is a tea that's brewed in the Amazon by shamans down there to help people get well. And it's a psychedelic medicine. It's a plant medicine. And there are lots of veterans who are going down south to do ayahuasca ceremonies to get well. So when I drank ayahuasca and I felt the effects come on and I started to be able to confront some deeper levels of trauma in my own self, I was still practicing psychiatry in a relatively conventional format, doing talk therapy and medications. And after a while, it started to dawn on me that I'm over here doing this kind of healing for myself, for some of the same kinds of problems that I'm prescribing medication and doing talk therapy over here for my patients. And the kind of work I'm doing with my patients kind of sucks compared to the healing that I'm getting for myself. And at that point, I was like, this isn't okay anymore, you know? And it was around that time when I got invited to get involved in this MDMA-assisted therapy study, this psychedelic therapy study for trauma, for PTSD. And I went through that and I saw, again, that was sort of going to be the future of mental health care. And so part of it was watching patients get well in the study that I was a part of, and part of it was my own personal experience. And when you get a kind of help that you've been looking for, that finally works for you, of course it's natural that you want to share that with other people. So that was a part of the reason. Yeah.
It's amazing that it took that to bring all this about. You fix yourself, and as you're fixing yourself, you're like, why am I doing this to them if I'm doing this for me that's working? I like that.
Yeah. And it's not to say I wasn't helping people. I mean, I think I was doing a pretty good job as a psychiatrist. I knew the tool set and how to take good care of people. But there was a moment that happened, and this really is maybe the best answer to the question, why did I get involved in psychedelic-assisted therapy? There was a moment in my practice a bunch of years ago, and I tell this story in the book that's coming out in March, but I went into work one week and 2 of my patients had taken their own lives within 24 hours of each other. And I knew that these guys were in trouble. I knew that they were on the edge, and I knew that they needed a higher level of care. And as your audience knows, I'm sure they're aware that the mental health system is broken. It has a lot of holes in it, and people fall through the cracks. And these guys didn't get the help that they needed, and I was furious about it. And it was the second time that I thought, okay, I'm going to quit psychiatry again. So I reached out to a mentor of mine, much older than me, another physician, and I started ranting and raving about how fucked up the system is and how we got to, I'm out of here. And he says to me what any good mentor would say, look, you're not in any position to make a big career decision. You're in pain. You need to go look at your pain. Don't make any big changes in your life until you do that. And at that time, this is like 15 years ago, I was interested in learning more about psychedelic therapy. So I was reading a book about it, and I thought, well, this might be a good opportunity. As I mentioned before, I'd been in therapy for many years already at that point. I thought, well, I'm going to try something a little bit stronger this time because these are strong feelings that are coming up. So I decided to try psychedelic therapy for the first time. And I found someone who would work with me, and I held the medicine he gave me in my hand, and I said, show me the full extent of my helplessness and my anger. You got to be careful what you ask for, because within a couple of hours, I was like an infant who didn't know. I didn't know how to speak English. I didn't know how to understand what he was saying to me. I couldn't read the clock. It was a old-fashioned analog clock on the wall. Couldn't read it. And I started getting really paranoid and scared that maybe he poisoned me or I broke my brain or something. And he kept saying to me, look, it wasn't okay that they left you like this. And I was thinking to myself, when there was a part of me to think about it, I was thinking, this isn't me. This isn't my story. Nothing happened to me in my childhood. Not like this. Anyway, the long story short is the next morning I call my mom and I say, hey, did you leave anything out of my birth story? Because it seemed like what was going on in the session yesterday was pretty early. Like I felt like an infant in a crib being left there. And she said, you know what, there is a thing we didn't talk about, which is that when we got home from your birth, when we got home from the hospital, I was having a complication of childbirth and they rushed me back to the hospital and I was there for a week. And you were with your dad. He was 24 at the time. And when your dad came to pick me up at the hospital, I said, where's the baby? Because you weren't in the car. And he said, I mentioned to somebody else in the student housing, they were in college still. Maybe if they hear a baby cry, they could go, check and see if he's okay. And, today we wouldn't think about leaving a 6-day-old infant in some place by themselves and go out and leave the home, right?
Right.
But the point of the story is that my body knew that there was a deep injury that had occurred, and my body showed that to me in the psychedelic therapy, and nothing I had done up to that point, including a bunch of ayahuasca ceremonies, had ever shown me that. And it was in me. It was in my body. And then the next day, my mom confirms that something significant happened to me. And it started to help me understand all the problems that I'd had in my adult relationships. And it took me some months to work through and integrate and heal from that and understand the depth of it. But it set me free to do what I'm doing today. So it was a huge gift for me.
Yeah.
Pretty crazy.
And you would think when you were 6 days old, you wouldn't even notice that. Whether it was
right.
embedded there, but you're probably laying there screaming for hours.
Right. In the field of medicine, we used to, it sounds crazy, to say this, but we used to think that babies couldn't feel pain. And so they would literally do open heart surgery on babies without anesthesia because the belief was that, you don't really start to perceive pain until later. Isn't that wild?
Yeah, that is wild. The first thing they do is hit the baby's ass and baby cries on them because it gets pulled back. Real pain.
And I think it was sort of this view that if you are so young that you don't consciously remember something, right, then you didn't feel it.
Right.
The truth of the matter is the body feels it and remembers it.
The brain remembers it.
Right.
Obviously. It embeds it somewhere. Little dark corners.
Exactly.
But we also grew up in an era where you got hurt, you put a band-aid on, you said go back outside, don't sleep in the house. So,
that's right.
That's also the world we lived in, as opposed to what they're living in today. Where they pretty much get sent out of the house bubble wrapped and don't fall.
That's so true. We went from under support to over support a little bit.
Yeah. Don't drink from the tap. Oh, look, let's buy a $30 bottle of water because it's better for you. No, it's not. It's
water.
Right. And yet we're still alive to tell a story.
Right.
And I have another question coming in. Let's see. At Me More, how do psychedelics like MDMA and ketamine differ from traditional psychiatric medicines? Thank you.
Yeah.
More.
Good question. So the short answer is that conventional psychiatric medication is about suppressing difficult experiences. So when they work, which sometimes they don't, but when they work well, they suppress difficult experiences like anxiety, depression, suicidal thoughts, mood swings, panic attacks, insomnia, and so on. What psychedelic medicines are designed to do is sometimes they're called evocative treatments. So they evoke what's already inside of you. So the experience I shared of my own psychedelic therapy and having this thing come forward from when I was 6 days old is a good example of that. So these experiences of taking a dose of a psychedelic medicine with a therapist, they're not fun. They're not easy experiences. Oftentimes there's nasty stuff coming out of you, traumatic material, but the therapist is there to help you integrate and work through those experiences. And so these psychedelic drugs can work as a catalyst where you only take them a few times, which is also very different from conventional psychiatric medication, where typically you're taking it every day or sometimes multiple times a day.
Yeah. And sometimes they're giving you two pills, one to bring you up and one to bring you down.
Right.
It's not like that happy medium, and I can never understand that.
Yeah, it's so true. And the biggest drawback, well, there are different kinds of drawbacks to psychiatric medication, obviously side effects and weight gain and, sexual dysfunction and, diabetes can happen from psych meds. But another big one is that they don't actually get to the root causes of your condition. So we like to use them as kind of a light touch, short-term intervention. That's the other thing is people often get prescribed these medications and then nobody ever talks to them about when am I getting off these medications.
Right. And that's what I wonder about. Because actually, my daughter is on them right now. One for anxiety, one for depression. And like I said, one brings her up, one brings her down, so it makes her level. But if she doesn't take them, she was panicked.
Right.
I've got to take my pills when you run me my pills, and like, you're relying on it. You can't be reliant on something like that. It has to be a point where you can get off of it.
Absolutely. It's sort of like if you break a bone, you want to have a cast for a while.
Yeah.
But I don't think anybody would sign up to have a cast on their arm for the rest of their life if they broke a bone.
Right. Well, I dislocated my knee and had it operated on. I wish I would have had a cast or something because it never healed right, but that's neither here nor there.
Yeah.
But that was back when they experimental surgery, not what they do now.
Oh, wow.
Yeah.
Does it work right now?
Well, right now I have this arthritis of a 70-year-old, and I'm probably going to have it replaced.
I see.
When I stand up, I sound like a transformer going cracking.
Oh, boy.
That was, like I said, that was the 80s. That's when we grew up, and that's when it happened. They went into exploratory, they fixed what they could, and moved on. That was it. Here's a brace for a little while, and go back to what you were doing.
Yeah,
That's
the field of medicine evolves very slowly.
And when it evolves, it changes, and it changes drastically.
It's really true.
My older brother just had his knees replaced, and they get up and they're walking. It's like boom, they're out of the hospital within a couple of days, and they're walking around.
Amazing.
Back then, yeah. Back then, you didn't even think of that.
It's really incredible. I mean, the shoulder replacements, the hip replacements, the knee replacements. I mean, they have come so far. It's really amazing.
It all has to evolve sooner or later, and you're helping this part of it evolve. So that's a great thing. Getting people off of that, I have to do it this way, and change it, and oh my God, I'm getting fixed, and that's really a good thing. Let me see, I have another question here. You did this too, wants to know, what are some of the biggest misconceptions about psychedelic therapy? Thank you, you did this too.
Wow, it's a great, really good question. Probably the number one misconception is that taking a psychedelic substance in a therapy session with trained therapists in a safe setting for the purpose of healing is completely different from taking a psychedelic drug at a concert or a party or for fun with your friends. Time after time, I meet people, whether I'm on a plane or at a party or something, and people come up to me and say, "Hey, what do you do?" And I say, "I train people in psychedelic therapy." "Oh, man, I took LSD like 50 times with my friends. And then I finally had a psychedelic therapy session, and it was like I was on a completely different experience. Like it didn't even feel like LSD." I hear this all the time. So sometimes people, when they talk about psychedelics, are coming from an environment like, following the Grateful Dead, let's say, or going to Burning Man or something like that. And I'm all for people having fun, as long as they keep themselves safe and they're responsible and take care of themselves and so on. But one of the dangerous things about psychedelics, taking them outside of a safe therapeutic environment, is that because they are expressive, evocative treatments, they can bring things up for people. And those things that come up can be really scary. Even if you're with friends, even if you're taking them to have fun, some dark corner of your mind can explode on you. And, I have good friends who are not beginners with psychedelics. Okay. And a number of my friends have come to me and said, "Will, I want to tell you about something that happened. I went camping by myself. I took some mushrooms. And all of a sudden, I wanted to kill myself in the woods by myself with my gun. And I was hanging on for dear life until it wore off." That's really scary, And these are people who are not folks with depression or PTSD or, any serious mental illness. And I'm saying this because, when you hear these stories of, "Oh, so-and-so took LSD and he jumped off a balcony," or "So-and-so took LSD and he got into a confrontation with law enforcement." Yeah, that happens. And it's tragic because these people many of them are just having something from their mind come up that's real intense and real scary, and they're confused. People get hurt.
Now, when you did it, was it just one person with you, or was there other people there, God forbid, that you found and they needed help to help you?
I was just there.
Something where you have like a group of people there just in case.
It's a good question. In the research setting that I was a part of, we had 2 therapists in the room, and the participant was required to stay in the clinic overnight with a sitter who was there all night long in case they got scared or needed something. So they were really well held by a big team. Obviously, that's pretty expensive if you're going to try to envision this in the future.
Mm-hmm.
In the setting where I experienced psychedelic therapy, it was one therapist and me. It's just the 2 of us. But even that is, when you think about the hours that a therapist makes a pretty good wage, usually at least $100 an hour, something like that. And you start thinking about the expense of that and how are people going to access this that really need it, right? So one of the ways to solve that problem that I'm pretty excited about is we are finding out that working with people in groups can work really well, especially if that group, for example, a group of veterans, have a shared life experience that they've been through together. If everybody's a special operator, or everybody was in the Marine Corps, or even just in the armed forces in any capacity, and they're a veteran, you kind of understand a lot about what other veterans in the room might be dealing with.
Right.
So you can begin to see how making sure that we get this into the hands of the people who are really suffering, who really need it the most. We got to be creative about how that works.
I believe we had interviewed somebody else, and they did it like on a retreat, and they did this kind of medicine. And they said they had to have extra people. Like you sat there, you couldn't read the clock, and you were like ready to lose your mind. So they had other people there for support to make sure you didn't hurt yourself or anybody else. You know,
That's
as
right.
this was going on. So you got to figure it's not something that, yeah, it's going to work, but it's going to take a team to make it work.
Absolutely. Absolutely.
And if you can do that, like you said, bring your group in or bring a group in of people that will understand what's going on, that might help you even better. Yeah.
Absolutely. Yeah, we've seen this in Oregon. I mentioned earlier that Colorado and Oregon have approved psilocybin. And there are many centers in Oregon that work with groups. We have a center there that is where we train the people who take our psychedelic therapy training. And as a part of their training, they go through a group experience with psilocybin in Oregon. And there are many helpers in the room to hold a group.
Okay. I have another question then, if you don't mind.
Sure.
Main Girl 7 wants to know, what role will education ethics play as the therapies become more mainstream?
Man, your people have the best questions.
I have really good people that come on and watch the show, and they throw really good questions out there.
Amazing. I'm so glad that you brought up the question of ethics and education. I want to talk about ethics first. The ethics of ordinary mental health care is one thing, right? So confidentiality, prioritizing safety, making sure that the person gives informed consent before you do something with them. These are some of the sort of fundamentals, the basics of ordinary therapy. When you get into psychedelic therapy, you're at a whole nother level of complexity and subtlety with ethics. For example, when a person is in their psychedelic journey, they might feel really scared. They might want to hold someone's hand. They might need reassuring touch on their shoulder or their feet, for example. And in ordinary therapy, you tend not to touch the patient, right? Usually physical touch is not a part of ordinary therapy. So if you don't have a conversation with your patient during preparation before the psychedelics on board about whether touch is going to happen or not and how it's going to happen, and reassuring the patient that under no circumstances is there going to be any sexual touch, for example. That should go without saying, but it needs to be said anyway. If you don't have those conversations before the person's on the medicine, well, now they're in an altered state, and they're not even, from a legal standpoint, they're not eligible to consent to touch, right? But now your patient is freaked out and they need a hand to hold, but you didn't do your job. You didn't get the agreement in place before they're in an altered state. So now what do? So now you're going to bind. So maybe then you do hold the person's hand, and then the medicine wears off, and the patient says, "Hey, wait a second. I never said you could touch me. I never said you could hold my hand." Well, you needed a hand to hold when you were on the medicine. Yeah, but I didn't. You see what I mean? So there are things like that have to be held very, very carefully, and it has to be done the right way. Another example is therapists who are trained to provide ordinary therapy when people are not in altered states. usually talk a lot. Usually there's a back and forth. It's conversation. Maybe somebody's talking about their suicidal thoughts and you're maybe challenging those thoughts or helping them see a different perspective. Psychedelic therapy works the best when you don't interfere with the person's process as much as possible. And therapists are human beings too, and if somebody is on a psychedelic medicine with eye shades and earphones on and they're quiet for a long time and they look really still, the therapist might get bored. They might get on their phone and start checking their texts or something.
Right.
Not good, because when you're on a psychedelic, you're very sensitive. And this might sound kind of woo-woo, but you can tell when the person is present or not, even when you're not watching them. And so the therapist needs, from an ethical standpoint, to learn how to be really, really, really present, and also needs to handle their own whatever's coming up without interfering with the journey of the client. So we teach a lot of ethics. There's a lot to go over. There's a lot to learn. So that's a really important part of education. In terms of like what's going to actually be required for education, it's not totally clear. Hopefully the FDA is going to be approving something in the next year or two. And at that point, it's going to be really interesting because the FDA's they only regulate medication, they don't regulate therapy. So it's unclear what they're going to say about what's required to work with these things.
And that would be something that you would work with them, or they would tell you. How would that work?
Great question. So the state of Oregon and the state of Colorado have clear rules on how much education a person needs before they get that license where they can work with psilocybin. In Colorado, it's a minimum of 150 hours of education. And then you have to go to one of these practicum experiences like what I described we do in Oregon. And then you need 40 hours of consultation after that. So it's a pretty substantial amount of education for a person who's already licensed as a mental health care practitioner. For someone off the street, it's not a lot of education, right?
Right.
So right now, and maybe this is good advice anyway, all the time, whether it's psychedelic therapy or not, you want to know what the person's education was. You want to ask them, how did you get into this work? What did what course did you take? If they took a 3-hour course, that's one thing. Our course is 300 hours that we teach. So it's worthwhile to be an informed consumer. And there are places where you can find registries of people who have taken certain trainings. For example, on our website, we have a list of people who have finished our trainings. So it's important to know get those questions answered for sure.
Definitely. You don't want to just go to the guy on the corner and say, hey, let's do this, and you fix it without back checking him.
Yeah. It's always good to get a personal recommendation from a friend who had a good experience. I get nervous when people start using Google or, a random website to just, to identify someone to work with. It just feels more trustworthy to me to choose a provider who, someone I know and trust had a good experience with.
You really can't trust Google reviews anyway. You really can't.
I know. I know.
Yeah, I've had people say, "Oh, I went to this hotel and they offered me 10% off. I gave them a good Google rating." Really? Oh, so you're good because you gave me a discount, or?
Yeah.
I don't trust Google reviews.
I hear you.
It's word of mouth, or something like you said, who's been there and done that.
Yeah.
All right. We've been talking for almost an hour now. 53 minutes has gone by. Let me ask you, how does somebody get in touch with you if they want you to be on their show, or if they want to talk to you about this? What's the best way for them to get in touch with you?
Yeah, so you can go to our website, which is a bit of a mouthful, but it's kind of self-explanatory. It's just psychiatryinstitute.com, all one word. The organization we started is called Integrative Psychiatry Institute. You mentioned that at the beginning. From the website, we have an email that you can connect with us through. It's called info@Psychiatry Institute if you have questions. Yeah, it's been great being here, Stephen. I really enjoyed the conversation, the questions.
Yeah, like I said, my listeners are great every week. They come up with something, and it's always fantastic how they interact and want to know more and more about what we're talking about. Last thing I want to bring up is every week we ask our listener, our guests, 3 things that you have to do every day, otherwise your day is complete. You have to give me a list of 3 things you have to do every day to make your day complete.
Oh, that's a great question. The first thing I have to do, so my wife and I wake up and we let the dogs out and we make some coffee. And then the first thing we do is we meditate, and not for a long time. Typically it's anywhere from 5 to 15 minutes. We kind of slowly watch the sky light up, as the sun comes up. And that's proven to be a really important resource for me. The second thing I do every day is I get some exercise. Personally, I like to get in the gym and lift weights 3 days a week, and then I take walks the other days as a kind of a down regulation. And the third thing I do that is a non-negotiable is I get enough protein in my diet. So that's been really good for me. It's helped me a lot, helped me regulate my blood sugar and so on. So I guess those are the 3 main things.
That's fantastic. Well, it was very, very nice talking to you. The conversation was great. Like I said, the questions were even better.
Yeah.
I appreciate you hanging out with me tonight. I'm sorry my partner Jake wasn't with us. Maybe it would have been a little more excited for you. I don't know, because Jake is out there.
Yeah, that'd be fun. Well, maybe we'll come back and maybe I'll come back and we'll have another conversation with Jake on.
Well, once your book is out, and if we got more going on, I would love to have you come back and talk, because obviously the listeners enjoy having you also. And it's more of an educational thing, and I like that. So I want to thank you for being here again. Misfit Nation, thank you for hanging out. ToosDay Crüe, we love you. We'll talk to you next week. Have a good night, everybody.
Thanks, everybody.
Thanks for checking us out and being a part of the Misfit Nation show. Don't forget to visit our website at themisfitnation.com. That's themisfitnation.com. Check out all our past episodes and get some of the great Misfit Nation gear for you and your family. As always, be humble, stay hungry, and keep hustling, because we are
Misfit Nation. Misfit Nation.